Currently, it's become quite routine to measure MRD negativity in patients who are under therapy for multiple myeloma. But what's lacking is, what do you do with those results? What do you do when patients have MRD negativity? Currently, trials, which include the MASTER trial, have looked at MRD-directed treatment decisions in a randomized fashion to determine if treatment can be de-escalated in people who are MRD negativity. So patients who achieve a stringent complete response with MRD negativity, they may not require autologous stem cell transplant. They may not require consolidation. Patients who achieve a stringent complete response with MRD negativity may not need indefinite maintenance therapy. They may be able to have therapy stopped after 2 years. We don't have all the final answers, but this exploratory trial suggests that we finally may be able to use MRD negativity in decisions about intensive or continuous therapy for patients with multiple myeloma who are fortunate enough to achieve a stringent complete response with MRD negativity. Currently, that should only be done in the context of a clinical trial. I would discourage community physicians for using MRD negativity for anything other than a powerful prognostic factor, but not as a driver for clinical decision-making.